Hi, everybody. I'm Dr. Abigail Hirsch. I'm a clinical psychologist and one of the co-founders here at Lynn Health. And incredibly excited to get to talk with Dr. David Hanscom tonight, who, as I've stepped in over the past 2 years to this world of learning about ways to drive pain reprocessing and recovery, and endless respect for the work that Dr. Hanscom's been doing for decades. So really exciting to get to hear about some of his old thinking, some of his new thinking. But I do think there will be food for thought about what can we do about chronic pain, what's driving chronic pain, how is it connected to emotions, and what are we learning is really at the cutting edge of what we're learning about how bodies and minds are the same thing. But so with that, David, you want to give a little introduction and background to who you are?
Yeah, thank you, Abigail. I'm excited to be here. And, your group does an awful lot of work that's really excellent work. So my personal mission is to try to get collaboration. So I'm an orthopedic spine surgeon. I practice complex spine surgery in Seattle, Washington for about 32 years, mostly at Swedish Hospital. I did a 4-year hiatus in Sun Valley, basically as a primary care back physician. I went from a tertiary care university to a small town. So I ended up doing primary spine care. And what was different about this for me is that I started out in internal medicine, but I started taking a surgical approach into chronic pain care. And I had no idea what was going on. And during that period of time from 1990, when was it started? I was in chronic pain from 1990 to 2003. It was just a nightmare. So what happened, I went from a fearless spine surgeon to a panic attack one day. At the worst point of my process, I was suffering from 17 different physical and mental symptoms. I, of course, am a physician, high-level surgeon, and I got all sorts of help and got nowhere. And it kept getting darker and darker for me. And finally, I was listening to one of my patients one day, and I was thinking about my own journey. And it finally came up, the only term I could come up with is that when you're in chronic pain, you're in the abyss. So then I found 2 research papers that documented that being in chronic pain has more impact on your life than having terminal cancer. And except it's a little worse because at least with cancer, you know the diagnosis. And so it's not a happy picture. So I was in the middle of that for 15 years. I came out, I would say by accident and luck. And so I'm excited to learn more about neuroscience, learn more clinical things that work and don't work. So we've been able to really help hundreds and hundreds of patients out of the hole. And then in 2018, I just started seeing 3 to 5 patients every week having failed spine surgeries or having surgeries recommended that make no sense. We're doing a lot of surgery on normally aging spines, and that doesn't work. The success rate of a back fusion for back pain is about 20%. So I was watching hundreds of patients go to pain-free. I'm watching people badly damaged by spine surgery. And I walked into a room one day, and there's a patient who did not need surgery, 32 years old, paralyzed. I said, that's it. I'm done. I'm not going to do this anymore. So I've seen so many patients get better with no risk, minimal resources, and watching people being badly damaged. And see, I was a guy who was doing the 15th or 20th operation on somebody. People had 5, 10, 15, 20. My record with one person had 29 operations on his spine.
Oh,
he did not need the first one. So once you start operating on normal spine, you start a cascade that's pretty darn deadly.
Yeah, correct. I'll tell you my favorite recently out paper on this is one about spinal cord stimulators, where I'll just summarize the punchline is, in addition to the fact that for most people they don't work, about a fifth of them have to be surgically removed. Right. So we've not just done one surgery that's failed, we actually are now doing 2.
Right.
All right, so I want to ask a question. Given that you and I both clearly share the bias towards challenges with medical intervention, and David, maybe you can hold the mic up a little bit closer to you. Some people are having a little bit of a hard time hear it. Yeah, I think that would be amazing when you're talking.
Is that better?
I think it is, and folks that were saying something can pipe in if it isn't. But yeah, so I was just saying, given our bias about trying to avoid unnecessary medical intervention, I'd love to just kind of kick things off by actually talking a little bit less about interventional pain medicine, but more about medication in general. And is there a role somewhere, or is there no role for medication in the pain recovery process?
So when I was doing this in Sun Valley by myself, I had to manage all the medications. And so remember, the driving force behind chronic pain is simply anxiety. And anxiety is an inflammatory state. Your whole nervous system's fired up. And so if you go into your doctor's office and start fighting over pain medications, it's very counterproductive. So my approach was I kept everybody on every medication from day one. I some people almost on 2,000 milligrams of morphine a day.
Wow.
So I just kept them on it. So what would happen over 6 months, the pain would actually resolve. Hard to believe. And of course,
you see it every day.
As the pain resolved, the need for medications went down. The side effects were worse than medication. So I never, ever had a problem taking people off medications if they engaged in the healing process. So if they're on opioids, keep them on opioids. Why else bring them into the withdrawal situation in the midst of all the stress of chronic pain? Same thing with things like Valium and Xanax and the anti-anxiety agents are actually really helpful in chronic pain. It was a long way of saying, same thing with sleep. If you aren't sleeping, you're not going to get better. You have to sleep. So most of the time, in somebody with chronic pain, it takes medications to start the process. So it's a long way of saying I'm a total fan of medications during the first 3 to 6 months. I have some people that are very successful, pretty much pain-free. They end up with like 4 Vicodin in a day, which is not much. So you're going from hundreds of milligrams of morphine to 4 Vicodin in a day. Who cares? That's not much. Anyway, the bottom line is that the patients took control of their own meds. I would monitor them very carefully. We never got in trouble. And if people didn't want to engage in the healing process, I just wasn't their doctor. So that was a key issue is they took control.
I love what you're saying, and I'm just going to try and echo it back because I think all the pieces are so important. That first, you can start a pain recovery journey no matter what medications you're taking, and there's no need to change anything. And I think that it's such a hurdle for people that are thinking about a kind of a brain first, behavioral approach to learning their way out of pain when they feel like, oh my gosh, but I have to get rid of the medications. And I'm even hearing you say in some situations, especially if you're not sleeping well, there might even be a reason to introduce some help to get you sleeping in particular early in the process. But that what happens is when the pain goes down, when you start to train your way, learn your way, soothe your way out of pain, then we don't need those medications. And that's the time then to start to do a taper.
Right.
So can we talk about tapering in specific?
Well, let me just talk to you first about the medications for a second. So the first target wasn't to get rid of people's pain. It was just to get people to sleep. And the research out of Israel shows that lack of sleep actually causes chronic pain. It's not the other way around. So people say, I'm in chronic pain, I can't sleep. It's actually the other way around. Chronic pain is what causes lack of sleep. So I would get essentially everybody sleeping within 6 to 8 weeks. Most of the time, medications, sometimes pretty aggressive medications. But if you weren't sleeping, nothing else really works. So we weren't worried about pain. We were worried about sleep. And then much to my surprise, was not expecting this. About 20% of people with just sleep had their pain go away. I'm going, what is this? So that's how actually the doc journey started. My process is called Direct Your Own Care Journey started, was simply trying to get people to sleep. I had read a book saying that most doctors don't acknowledge sleep as an issue. And I'm going, well, I can do that.
Correct.
So I got very aggressive on sleep, and it was shocking how much people better did with a good night's sleep.
It's really interesting. We definitely see that in our data too, which we ask our members to rate every other week, both their pain and their functioning levels, but also their sleep and kind of general anxiety. And for many, many patients, improvement in sleep is the leading indicator that I'm on the right path. Not for everybody, for many, many, many people.
Right.
The other thing that we're seeing sometimes is, sometimes medications is the way to do that. And sometimes even just finding the right relaxation technique and getting losing some of the anxiety about I have to fall asleep.
Right.
It's incredible how even those two pieces can start people on a different pathway in terms of their sleep, which then gives them the space, the time, the energy, maybe even the physical restoration for the pain to start to settle out.
Right.
Amazing. Maybe we'll shift just to a little bit of a different topic if we're kind of talking about bodies and bodies hyped up and hyped down. We work with lots and lots of patients with things like POTS, EDS, mast cell activation, and autoimmune conditions. And what's very clear to me is that these are labels that are super popular these days, and not great information about what are these actually, what's driving them, is a kind of doc journey or Lin pain recovery process appropriate for these?
So the answer is yes. And we can start talking about the cause of chronic disease if you want. We talked about that a little bit before.
That would be amazing.
So here's the problem. And I think I told you before the podcast, I have two missions in life. One of them is to get medicine back on the issue that symptoms, illness, and disease are caused by your body's physiology. When I say physiology, is how your body runs. So, for instance, a parked car has no symptoms. You've got to turn the car on before it has symptoms. And my friend Bruce Lipton pointed out really bluntly, somewhat crassly, is that what's the difference between a human being that's alive and a cadaver? They both have the same structure. And so the thing is energy and movement and nerves and everything has to be alive in order for you to have symptoms. So it turns out that the basis of all chronic disease is the same thing. So I'll talk about this in a second in our research group, but there's a group out of San Diego, UCLA, Texas, that have shown that every chronic disease, depression, anxiety, bipolar, OCD, and schizophrenia are all inflammatory disorders.
Oh, fascinating.
Turns out that Parkinson's, Alzheimer's, heart disease, peripheral vascular disease, obesity, hypertension, autoimmune disorders, cancer, osteoporosis are all linked by the same dysfunction in what's called the mitochondria. And as you know, the mitochondria are these little engines in the cell that have a reaction that creates energy for the cell to stay alive. And so when you're under...
It's like the gas.
Right.
It's what takes gas and sparks it up and makes us go, right?
Right.
We're going to go back to the car analogy.
So the essence of chronic disease is being what's called chronic threat physiology. In other words, sustained fight or flight. And if you're driving your car down the freeway in second gear, it's going to break down because you're revving up too far. So threat physiology is necessary for survival. It's how we evolved. It's how we stay alive. So you need it to stay alive. So the essence of chronic illness and disease is sustained threat physiology. And the essence of healing is minimizing the time in that state and maximizing your time in safety physiology. So in safety physiology, your cells...
So, wait, David, can I ask a quick question
Absolutely.
there? I'm going to ask one, and then I'm going to ask a great one that just came in the chat as well. So I'm again going back to the car analogy. What I'm kind of hearing you saying is that the breakdown is going to be caused because we're driving in second gear, but the car might break down in different places.
Right.
And so all of these different diseases are just that maybe it was the spark plugs that were out first because we were improperly driving the car, or maybe it was the clutch, or maybe it was, I guess nobody has a clutch anymore, but for us old farts, we might remember driving these cars.
Yep.
So all of those different chronic diseases are really what part in your body happened to manifest the same underlying problem of being in a tuned up state. And now let me ask the question that's coming in the chat. So I think it's very interesting. Can you be in flight or fight without feeling like it?
Absolutely. Totally. So let me so let me say two things here quickly. One of them is the model we put together is called dynamic healing. So when your stresses or your circumstances, or what the research term is called allostatic load, is perceived as a threat, does not matter if it's a real or perceived threat, your nervous system takes in the data and says, are you safe or are you in threat? So every piece of data is pulled into place. Your vision, sight, feel, etc., are all pulled into the system. So your body's either in safety or fight or flight. It can't be in between. It's either safety or fight or flight.
Right. This is an on-off switch, not a...
Well, no, it's a gradation. I mean, in other words, we talk about homeostasis, but what's homeostasis? So the bottom line is you're towards safety or towards threat. The issue here is that subconscious survival reaction is 1 million times stronger than your conscious brain. It's a 1,000,000 to 1 ratio. So your physiology is your unconscious brain, body temperature, your pupils dilate, you talk, everything I'm doing right now is
your
unconscious.
Breathing.
Right. So that processes about 40 million bits of information per second. Your conscious brain processes 40. It's 40 million compared to 40. It's a 1,000,000 to 1 ratio. So one of my missions in life is to bring medicine back into a physiological realm. We are taught this in medical school. It's not new data. And what happens is that, again, under sustained physiology, body breaks down, but it happens right at the single cell level. So these mitochondria, there's actually between 100,000 to 600,000 mitochondria per cell. And so they're all cranking away. I'm told that there's 3 billion reactions per second in each cell. So it's incredibly
really a miracle,
complicated.
Isn't it?
So under threat physiology, what happens is the mitochondria breaks down in 3 different stages. Then it has to heal in 3 different stages. Under sustained threat, the mitochondria cannot regenerate. You're stuck. And it's a little complicated how that happens. So you're in sustained threat physiology, and your body creates white cells that attack your own tissues. So getting back to autoimmune disorders, that's because your body's attacking itself. Mast cell activation. Well, why are the mast cells activated? Well, that's a fight or flight response. POTS disease, the blood pressure changes. Well, that's all sorts. When your body's inflamed, your blood vessels dilate. So again, everything is explained by physiology.
That's so interesting. And would you put EDS in that same category?
So I like to stay off the EDS topic. I'm an orthopedic surgeon. I've known about EDS for 50 years. And the answer is it's just loose ligaments. And so I think when medicine, there's a bunch of diagnoses, which I won't go into today, that medicine, as you know, has a need to find a reason for everything. And I'm sorry, with EDS, you have loose ligaments. They're not tight. It's tight ligaments that cause pain. So the reason why you're having pain is your entire body is inflamed. So, okay, you're inflamed with loose ligaments or loose with tight ligaments. Nobody has proven that EDS by itself has caused the problem. So EDS, so it's not to say that you have pain.
In other words, EDS is just saying you're on the spectrum from tight to flexible. You're right. It's not how tight or loose your muscles are, but that you happen to be coincidentally on the looser side,
right,
and have something that has gotten you into this prolonged subconscious, stress, elevated stress, and therefore your mitochondria aren't repairing, and therefore you are going to experience the chronic pain sensations.
Well, let me explain that a little bit differently.
Thank you. Help me put that back
so
together.
In 2002, the family practice world came up with a term called medically unexplained symptoms, MUS. Have you heard of that term?
Yep.
Okay, so I can't begin to tell you how inaccurate that is. Okay, so if you're under fight or flight, everything's wrong. Everything. Your heart rate's up, you're breathing too fast. The biggest thing is your immune system is on fire. Half your brain is part of the immune system. The glial cells in your brain, which are the supporting structures of your brain, 50% of your brain are glial cells, which are actually immune cells. So your brain itself is inflamed. So it takes much less trauma to actually stimulate those pain pathways. Secondly, the speed of nerve conduction doubles. So now you have these sensory nerves in your skin that are twice as sensitive just because your body's in fight or flight. So the symptoms, so the term should be MES. It should be medically explained symptoms, right? They're complete. I mean, symptoms don't just happen. You think autoimmune disorder just happens? So what I get frustrated with in medical school, we know about autoimmune disorders, but people never told us why. So going back to the dynamic healing model, you have your stresses or input, you have the nervous system, and you have the output. So what we're doing in medicine, we're treating just symptoms. But the real issue is the balance between your stresses and your coping skills. So if your stresses overwhelm your coping skills, you go into fight or flight. So on a given day, the stresses are just too high, you go into fight or flight, or you haven't slept or whatever, and your nervous system is hyperactive, you go into fight or flight, or there's some personal financial stress that's over the top, so your nervous system goes into hyperactive. So then your normal stresses set off the fight or flight when normally they wouldn't do that. So I noticed 30 years ago, before I knew anything about this, that if people were under stress, I never did the surgery, ever.
Interesting.
And it was incredible. It wasn't psychology involved, just let things settle down. And once things settled down, it was shocking to me how many people actually just went to pain-free. So I ended up cutting into my surgical practice terribly. I didn't do anything. All I asked a simple question you asked before. It says, "What's going on?" It wasn't a big psychological interview. Just what's going on. I mean, if when you're under stress, your body goes into fight or flight. So at the most basic level, stresses or circumstances translate into physiology, translate into symptoms. Period.
All right. So let me read. There's a question that came in here, and I'm going to see how much I've learned so far tonight, and you can tell me what's right and what's wrong in my guess about the answer here. So the question is, what about if POTS and EDS came from a concussion? So I'm going to guess that a piece of this is, well, a concussion is, you don't get a concussion without some kind of stressful something happening. And maybe that's enough to trigger that stress response, and therefore your car particularly has experienced as POTS or something else. But tell me now what's right and wrong in that.
There's nothing wrong with that. So the answer is, I'm going to say first of all, remember, each cell in your body has between 100,000 to 600,000 mitochondria per cell. So the human body is incredibly complicated. So none of us really know what's going on. We just put things out there that help the body heal itself. So what I'm doing is not about believing in David Hanscom. It's not about my doc journey. It's not about my book. It's about connecting to your own capacity to heal. So the answer to the question is, it doesn't matter. So I've seen people, I can tell you hundreds of stories. It doesn't matter what the cause of the problem is, your body can heal. It's
That's a lovely question. So maybe one doesn't even need to track back to why am I experiencing these symptoms. Right. It's enough to say, look, I know, and that's interesting because we definitely work with people who have had symptoms for so long that the original why is not there anymore. Right. But that we sometimes talk about kind of high alert, that the set point has just gotten set at a place that's very high, and thus is kicking off all of these physiological responses. But you're right, can absolutely be reversed by dialing down the general stress levels, which understanding is going to.
Except the most stressful stress is the stress that you can't control.
Correct.
Right? So that's the most stress. I mean, if you can control the stress, you're going to control it. So go back to the original model about physiology. Okay, so your body goes into fight or flight. Your body's full of inflammation. You're consuming fuel. Your heart's racing. You're just on high alert. So the way every living creature evolved is that something causes this fight or flight response. You solve the problem, and life goes on. If you can't solve it, you kick in more of a chemical reaction, and you up the ante. So my cat has the same reaction, except humans have a word for it called anxiety. And when you can't solve the problem, you kick in more chemistry and put in anger. So anger and anxiety are the same process, just a matter of degree. So when you are angry, your body's physiology is way up. So anxiety and anger are the result of stress. They're not the cause. So what we've done in our work group is we want to get rid of the word anger. We want to get rid of the word anxiety. They're the avoiding those sensations. Avoiding anxiety is a driving force behind most human behavior. And when you can't get rid of the anxiety, you start doing all sorts of crazy behaviors that are psychological diagnoses. But anxiety itself is a driving force. It's a physiological state. It is not a psychological diagnosis. It's a physiological state. So what happens, of course, all sorts of behaviors come about. We'll do anything to avoid the sensation. We're trained not to be vulnerable, except vulnerability is the essence of human relationships, so it's a big problem, right? But the bigger problem with anxiety and anger is that physiologically, your thinking brain goes offline. You absolutely physiologically actually can't think.
So we were already at a disadvantage because we only have 40 million thinking connector, bits per minute and 400 million not thinking ones. But now we've actually taken half of those offline, or more than half of them offline.
Well, let me just go a little differently. So the brain has 80 billion neurons, nerve cells. Each one of those neurons is associated with 10,000 other neurons. So the number of connections to the brain is almost infinite. So then there's another 80 billion glial cells, which are the connecting structures. So I talk about 40 million bits of information per second. That's what the body's processing from your eyes, ears, skin, whatever it is, your abdomen, your stomach. So that's all the sensory input coming in, but your brain itself has about 80 billion neurons.
Unbelievable. Every time I hear those numbers. So let me pull in one more question from the chat here. Somebody's saying, hey, I eliminated my inflammation in my body, which was high. So I assume, maybe an anti-inflammatory diet or something like that, but my pain is still there.
So you have not eliminated the inflammation. So, here's the other problem as far as healing. So I compare the healing process to like a forest fire. So with the forest fire, you have all sorts of strategies, the bulldozers, the helicopters, there's people digging the trenches. So there's lots of strategies to contain and solve a forest fire, and everything counts. So chronic pain is really complicated. It's influenced by almost everything you can imagine: your family, your circumstances, your environment, your body, your genetics. Everything influences pain. So each person has to solve their own problem. So it's always a multifactorial solution. People say, well, I tried mindfulness, it didn't work. We can help 10%. My sleep's better, I still hurt. Well, I could help 20%. Physical exercise, diet, all these things add up. So it's always a multi-pronged self-directed process. One modality by itself never works. So it's at least 2, maybe 5. I personally, I don't know. You develop a repertoire of about 30 different tools that you use every day. So remember, life comes at you. So if your stresses are too high, you're going to have pain. You're supposed to have pain. If your brain is under-resourced and just hyperactive, you're going to have pain. But then, like yesterday, for instance, I don't know what happened. I just got triggered. I have arthritis in both my knees, and most of the time I do just fine. It's not bad enough to have surgery, but I couldn't walk yesterday. Both knees were swollen up. I was miserable. I started thinking about total knee replacement, and I cut out the junk food. I've been eating really badly. So I cut out the junk food. I exercised a couple days in a row, which I had not been doing. I got back to some of my basic tools that I do. And today my knees are almost pain-free. So what I've learned to do, the question was asked before, can you be in chronic pain and not have anxiety? So what you learn to read your body. So remember, I had 17 different symptoms. I had migraine headaches. My ears were burning. I had skin rashes. My scalp would itch. My stomach was a mess. I had back pain, neck pain. I had anxiety, depression, major suicidal depression, OCD. I had 17 different symptoms. They're gone. They're just gone.
And the key is finding the formula that lets you really root out that fire. And keep going.
What's a little different than that? So here's the deal. And this is where I love to work with Lynn Health a little bit more, because I think what we do is very collaborative. In other words, the doc journey provides a very deep foundation, but it doesn't always solve the problem. So, you can read a book on how to play the piano, but you have to actually practice, right? You need skill. So the first phase is just homework. Just understand the problem. I know your group does a lot of pain education. So pain education is not going to solve the problem. But if you know what you're doing, it helps, right? So it gives people control.
And it gives you the motivation. That's right. How I really see it, is understanding what's going on helps people to say, oh, okay, those rational parts, this makes sense. And I can harness them to motivate myself to do, motivate myself, or maybe my coach and I can motivate myself.
So let's take chronic fatigue.
Great.
You're driving the car down the freeway in second gear. Of course, it's going to wear out. When your body is just going 100 miles an hour, 1,000 miles an hour, you just consume energy. Plus, humans have an issue that 25% of all our metabolic energy is used to run our brain. So if you're in this massive survival
if your brain
reaction,
is running on overdrive, that's going to be a lot of extra consumption.
Well, they say master chess players lose about 15 pounds of weight during a chess match.
That's fascinating.
That's just their brain
Fascinating.
Working. Right.
I want to just do one loop back because I'm seeing it coming up in the chat a number of times. Lots of questions about, well, I got my inflammation levels measured and there was nothing there, but I still am in pain.
Right. So the
what does that mean?
The inflammation that you're having is called SCI, systemic, excuse me, systemic chronic inflammation. So with acute inflammation, your inflammatory markers go up. So with systemic chronic inflammation, it happens at the mitochondrial level. There's a molecule called ATP. ATP, as it breaks down to ADP, it's a chemical reaction, you generate energy. So what happens under chronic threat or chronic stress, the ATP that's inside the cell goes outside the cell and is highly, highly inflammatory. So with systemic chronic inflammation, you can't measure it. Cannot.
I think that's, or maybe the way to say it is the measure is that I'm having different pain sensations that are not resolving.
Exactly.
And that is our indicator that it's time to reset the micro engines that are running our whole, everything.
But see, it's dynamic. Okay, so I told you yesterday my knees were just a disaster. But quit doing if I get fired up, so sometimes these skin rashes pop up in the back of my wrist. I mean, I feel anxious. I felt fine yesterday. I could not figure out why my knees were so bad, or my scalp starts to itch. And I know what I'm not doing, so I try to get away with it and get lazy a little bit. So what happens with me, my feet start to burn, the skin rashes pop up, my ears start to ring, my scalp starts to itch. So if I go back and just doing the tools that I know how to use, they go away almost instantly. So remember, it's a dynamic process. You're going to be in these symptoms all the time, every day. But you can come out of them very quickly. But it's a learned skill set.
David, we see that in our data really clearly too. In general, like people will kind of, their pain levels will get less. I'm going like this because we plot for our coaches that high is always good, but I know most people want their pain to go down, so I'll move my arms this way. So the pain levels will go down, but it never goes down straight. There's always spikes, and what you see is earlier in the learning process, when people are developing their toolbox, when they're learning what's the right reset for them, when they're trying out 30 different things, and finding the mix that's the right formula. It takes a long time to recover from those kind of flares. But what happens as you're further down the process is it's just like bloop, bloop, quick thing that happens. I get my pieces back in place, and then the whole thing settles out.
Right.
Yeah.
So can I hit you with a couple of metaphors?
Yes. And then I'm going to hit you with a couple doozy questions. How's that? Good.
Okay. So there's two metaphors. So the healing journey consists of three parts, three categories. So just picture a metaphor of a tree, and the soil is your entire past up to this very second. So most of us have a past that's not perfect by any means. And so we tend to whitewash it, analyze, and fix it. But if you visualize a tree growing into the soil, and what can you learn from the past is a lot different than trying to change the past or analyze it or fix it. So the question is, so as you let yourself be with the past and learn from it, that's a much different energy. And so the deeper you go, the better it is, except a lot of it, there's a lot of emotional pain. And since emotional pain and physical pain are processed in a similar manner, why do you want to hurt? So the second part of this called the sequence of healing, the letter C sequence of healing. So the first one is connection. Just being aware of what's happening. Am I triggered? Am I not triggered? The trunk is confidence. In other words, there's a whole tool set like so you important. Use that the confidence is how do you learn to be with your past? Because it's not that easy. But once you do it, it's much easier than being in pain. So the confidence is the trunk, which again, a bunch of learned skill sets, takes practice and repetition. And then the real healing occurs is actually the top of the branching is creativity. So your brain starts shifting.
Oh, I love that.
it starts shifting away from the pain circuits. If you try to fix this pain circuit, you can actually reinforce them. So it's connection, confidence, creativity, and that's the opposite energy of what I call self-esteem, which is a disaster, different conversation. So that's the healing journey, is from reactive to creative. Anytime you're anxious or frustrated, you're reacting to something in the past that just showed up in the present. And the healing occurs with creativity. So there's two separate skill sets. One is learning how to process anxiety and anger, a million times stronger than the name for this survival response is anxiety. And when you can't solve it, you become angry. So anxiety and anger are actually gifts. Your unconscious brain, they're automatic, they're hardwired. It's what you have, but it's not who you are. So learning how to separate your identity from this reaction is number one, plus how to process that reaction. And then the real healing occurs by moving into joy. But if you're using moving into joy as a bypass, first of all, it's a mismatch. Second of all, the data shows it's actually inflammatory. Trying to bypass your survival circuits actually cranks up your inflammatory markers tremendously. Same thing with positive thinking, which is a way of suppressing negative thinking. And we haven't got a chance to talk about obsessive thought patterns today, which we probably should do on another day.
I know. I was going to say, so we're going to have more conversations, but this is, look, I'm learning a ton. I want to ask you one big question,
okay.
And then we're going to, there's lots of questions coming in the chat, and if people are having questions they want us to address, start thinking about getting them in there too. All right, so this is a bit of a magic wand question. We often, when people are starting with us, one of the things coaches will sometimes do is ask the member, if I had a magic wand and I could wave it and your symptoms would go away, what would you do? Very much, at least thinking for a minute about what the top of that tree is going to look like, even though we have to go through the process to get there.
Right.
So here's our question for you. If we could give you a magic wand that you would wave and the American medical system would magically transform, what would you want transformed, or what would it look like?
That'd be a very, very, very simple answer.
Good.
You have to talk to your patients. I mean, nothing. If you see, to me, I mean, it's a long story, but okay. Remember, safety versus threat. So remember, historically, people have always felt safe with their doctors. Right now, the business of medicine has taken that relationship away for the last 30 years. And so we're going the opposite direction. In fact, I just read an article today how doctors are burning out, but patients are burning out going to doctor. They don't like it anymore. Yeah. And I get it. So the data shows only 20% of physicians are comfortable treating chronic pain. Remember, I'm talking about chronic disease, not chronic pain. So to me, the mental pain is a bigger problem by far. Again, a different conversation. So again, going back to other conversations about the mitochondria, whether it's mental pain or physical pain, it's all the same thing. So try to get rid of the word pain and just think in terms of threat physiology. Try to get rid of the word anxiety and just talk about activated threat physiology. Get rid of the word anger to use hyperactivated threat physiology. So if you can't talk to your doctor and you go in there and they start fighting with you about pain medications, they give you 5 minutes to walk out the door. You've waited 3 months to see the doctor and they give you 3 minutes. You're not very happy. So what just happened to your immune system?
Right. So the number one thing, stress mode.
It's got to go back. It has to go back to individual care. We will actually, I would sound really grandiose here, but it's basically, in my mind, we have allowed the business of medicine to take us over. It's the doctor's responsibility to take it back. I'm not sure how that's going to look, but if you could triple or quadruple the time spent talking to patients, and the vast majority of procedures that we do are actually ineffective. So at 1/5 the cost or less of actually spending time to talk to your patients, you would change healthcare tomorrow.
I so agree. And it's interesting. We certainly don't have that magic wand, but I do think that's really a key of when we were building Lynn, and what we do with people is make sure that there is that time to have a person with information who cares about you, who has the time to talk, and can be at your side on the journey, because it's really important. It's your journey. You have to take it. You have to do the work, but it's incredible to have a trusted companion on that path with you.
Right.
So helpful. And a trusted companion who's been around the block a few times.
Yeah. I mean, yeah. I mean, it's gotten so bad. I mean, it's indescribable. I don't spend too much time in the negativity part of this, because that's why first of all, that's how my process evolved in the middle of a busy practice. So you don't have to have your doctor talking about all your troubles and issues and solving it. In fact, I never did that. It's actually counterproductive to do that. But I would listen, just try to guide you. That's why I wrote the book for the homework. I put together the action plan so people did it on their own. Then when it came in, we could talk about solutions or where you're going to go, what's going on, also get to know them. So it allowed me to be very efficient as well as effective. So it doesn't take a lot of time if most of the care goes to the patient. That being said, if I can have the patient do most of the work and may do less explaining, I can sort of hang out with my patient. Right. And that's where that's where the
magic happens.
That's where the magic happens. Right.
Well, let's hope that there's a lot more magic happening in the medical system in ways that are paid for by insurance, which is, just as an aside, another certainly thing that we're thinking a ton about here. And as we're starting to work with insurance so that people can get this kind of care covered by insurance, is how do you keep that person in it and that compassion in it, but also have it not be something that's only affordable for people who can, afford hundreds and hundreds of dollars an hour,
right?
Which is also not fair.
Right.
Okay, so let's shift gears for a minute, and I'm going to read a couple of specific questions here, and we can, hopefully get some folks some answers. So Liz wrote in a really good question here. Do NSAIDs affect chronic pain?
Yes, in a positive way.
Give her two more lines.
Again, nothing works on its own. And so, again, and there's different anti-inflammatories, there's different categories of inflammation. But, again, the biggest issue, of course, is kidneys and liver function and sometimes stomach issues. So you have to be careful. So, again, for that first 3 to 6 months while you're healing, that's fine. It's better than narcotics. We also know that 4 Advil is actually the same as Tylenol with codeine. So actually, they have a little bit delayed onset of action compared to narcotics, but they do work. But again, after 3 to 6 months, so I want to emphasize again, David Hanscom does not have a magic formula. What you're doing is you're using tools to allow your own body to heal. So for that first 3 to 6 months, if you're under a pain assault, you're still in fight or flight. And so we can use the medications to help break up that cycle. Great. Do you want to be on Advil the rest of your life? No.
There goes my light again.
So yeah. Anyway, so the answer is that's the answer is yes. Anti-inflammatories can help, not the solution.
Amazing. Here's another one. Well, this is a good one. Dr. Hanscom, I have chronic knee pain in both knees. One has been replaced and the other is bone on bone, but they feel the same. Could I have mind-body pain alongside arthritis?
Oh, yeah, you're going to love this answer. So I was shocked to find out about 5 years ago, there's been data around for 20 years that shows when they operate in the presence of untreated chronic pain, that the pain gets worse 20 to 40% of the time. The data also shows with bone-on-bone arthritis that the pain in your knee is not correlated as much with the severity of the arthritis as much as stress. So in other words, people with severe bone-on-bone arthritis often have no pain. People with minimal arthritis often have severe pain. And when they did the studies, they just used simple stress scales that showed that the degree of pain was correlated more with the stress than it was with the amount of arthritis. And like my situation,
100%.
I'm bone and bone on both knees. I did have a hip replacement because I couldn't even walk. It was bad. Anyway, but I have pain in both knees. But yesterday I was at 15 out of 10 pain. It was unbelievable. Today I'm about a 2. And some days I'm a 0. So I don't know all the reasons that it gets triggered, but it's one of my feedback loops. I may not feel stressed, but guess what? My body says I'm stressed. And so the answer is
it's time to put the tools back in place.
Yep. And so if you decide to do a knee replacement, I'm not against surgery. In other words, I'm not saying you should get a total knee replacement, but we do what's called a prehab process before every patient on elective surgery. In other words, you spend 12 weeks using the tools, calming people down. I had over 120 patients with severe spinal stenosis, which is pinched nerves in the spine, with matching symptoms that canceled the surgery because the pain disappeared. 120. I
So
didn't
David,
expect that.
you're going to love one of the things we're doing really actively here at Lynn is working with primary care providers to say the right frontline approach for all pain, no matter if you think it's structural or if you think it's not, start with a pain reprocessing, mind body, psychophysiological approach.
Right.
Let's see what happens.
Right.
Let's learn a ton. Let's get ourselves to a place where we've done everything we can to be the controllers of the dial instead of controlled by it.
Right.
And then is the time to just think about maybe we should look at a scan, or maybe we should look at surgical intervention, et cetera. And I think I will layer on early on. Let's look if there's some medications that we want to, to layer in there. But the key, do the simple medication things and do the work of the journey and the learning before you do the expensive, dangerous things.
So what would happen, a lot of patients canceled the surgery because the pain disappeared. And then about a third of the patients ended up with having the surgery, but the postoperative pain was better. We had essentially no wound infections because the inflammatory markers were down. And so it's called prehab. And the data shows that only 10% of surgeons actually do a prehab process before surgery, even though that's what the data clearly shows.
No question.
Yeah.
No question.
Can I tell you?
It's another thing we actually do quite a bit is working with folks who have decided they're going to do the surgery and saying, okay, I'm going to do the third back surgery. And we say, great, we're going to be with you. So the third back surgery is successful.
Yeah.
Yeah.
But
I have another great question in here for you. But say what you're going to say, and then I'll
Well, I just want to keep reminding the group that this is all physiological. And your physiology translates into symptoms. And so this is not imaginary. It's just in the medical profession has done most of you a horrible disservice by labeling you, not helping you feel safe, not helping you calm down. And these tools actually should be taught right there in kindergarten and first grade. If I had learned this stuff in elementary school. Oh,
you're going to love the other thing we're doing. We just started working with a pediatric practice who said, let's nip it in the bud.
Yep. Yeah. So
it's really exciting.
If I had, again, there's two parts of healing. One is learn how to process anxiety and anger. So we're never taught in school how to do self-calming techniques ever. And the other part's nurturing.
They do now.
My fifth
grader has a whole class. I was ecstatic when I saw this.
That is cool.
The only parent I think that jumped for joy at that part of the new curriculum. But it hasn't been.
But the other half of the equation is nurturing joy. So where in my lifetime I was never taught to nurture joy.
Yeah,
we're not taught that. That's a skill. So it's a learned skill set to process adversity. It's also a learned skill set to nurture joy. Again, they're separate skill sets. But yeah, if I had learned this in elementary school, I don't think I would have had a 15-year burnout. I know I would too.
I know.
Maybe I'm wrong.
I'm going to give one last question here. It's one we hear all the time. Let me just read it exactly. Any thoughts on healthcare providers that explain chronic pain as your core or back muscles are weak and strengthening those muscles will resolve your pain?
So again, let's go back to the same thing, that everything helps. So again, exercise helps, diet helps, sleep helps, medications help. All these things help. So yeah, with back pain, first of all, it's an inflammatory process, and it's number one. But second of all, the more you strengthen them, the less stress is on the muscles. So again, remember, it's this dynamic between your stresses and your nervous system. So if you can calm your nervous system down, your back pain is going to hurt less. But if you can strengthen your back, there's better input into your nervous system. So again, it's part of the solution.
And I'm going to give a slightly different answer. I'm going to say that any physician who's scaring you and telling you you're not strong enough, your body is damaged, that's why you're having pain, that statement is probably going to increase your pain. So if you can find a way to hear that advice about strengthening your core as, or standing with good posture as, oh, these are things that can be life enhancing, that can bring you joy, that can feel good. And they may have some impact on your pain experience as well. That frame is probably going to be more helpful than a terrify you frame.
Yep.
No question about
Absolutely.
that.
Yep.
So, oh, good. And the person whose question it is just chatted in. Thank you. That was a very helpful answer. So I'm so glad that we had a few minutes to address that one. So I just want to read one last comment here that is lovely. Sarah writes in, I can't wait to tell my primary care doc how much Lynn is working for me. And I would say that just, David, you and I are talking about this all the time, but we're not the ones who are going to make the magic wand happen. The
Right.
ones that are going to make the magic wand happen is every Sarah out there and every, Tony and Tara and everybody who has a journey that is helped by these techniques, whether it's with Lynn or with the DocFind or with any other version of this. Hallelujah. Go tell every doctor you've ever worked with, because it's really your voices that make this transformation happen. Really over and over and over. All right, I got to sneak one last question in because this person has asked twice, and it's a great question. Input on brain fog, please, and derealization.
I'm sorry, what was the question again?
Brain fog, kind of, sense of I'm not fully present.
So, yeah, no, absolutely. So it's a physiological problem because when you're in fight or flight physiology, the blood supply shifts from your thinking brain into your midbrain. In other words, you're in fight or flight. You're not going to be thinking arithmetic or philosophy when you're running from the lion, right? So the brain fog. So I went. I'm embarrassed to say I went through. I'm embarrassed. That was one of my symptoms was brain fog. So I was a good surgeon. Nothing changed there. I remembered everything I could know, but I couldn't process new information. So my cognition went down about 40%, and it comes back. Wow. So now, what I now know is the physiology behind it is that under fight or flight, again, half your brain's immune system. You've shifted the thinking. You shifted from the thinking brain into the survival brain, the limbic system. And so, again, it's not psychological; it's physiological. Once you adjust the physiology, which can happen relatively quickly, by the way, your brain works just fine. It's not a permanent thing. We also do know in chronic pain, people's brains actually physically shrink. You don't think as well.
That's
and when you treat chronic pain, it actually physically re-expands. So again, these tools are, it's about actually changing the structure of your brain. You process everything differently. And you go, again, you're moving into the creativity. The true healing occurs in the creativity, but you can't move into creativity unless you learn to let go of the survival skills. And they're both necessary.
Well, I really just love that this idea, first of all, brain fog is not a lifetime curse. It's okay. It's one more symptom that can go. That, again, to summarize the underlying theme, all of these experiences are very real. And what I'm learning today, which you told me before we talked that you've had a revelation and are changing your whole view of the world. And I think that tonight that's now spread to me. This whole view that, is this mind or is this body? Is this physiological or is this thinking? The answer is, well, we're all physiology. That is the root of everything, of how we do everything. And so, of course, our physiology is shifting in all kinds of ways all the time, and in ways that we can't ever possibly consciously know because just the math doesn't add up. I also learned tonight. And so what we can do is we can use some of our conscious brain, some of our, strategies to climb your tree, to start a reset process on that physiology. And it's an incredible gift and a tool that we have a mind that is able to help and reset the physiology. Is an amazing override gift that we all have.
So I will say that I'm going to leave it to the last thought here that sounds completely backwards. So I want you to not believe anything I said tonight.
Good. I like that conclusion.
No, I'm serious because, here's the deal. This isn't about believing David Hanscom or the doctor in my book. It's not about this. It's about connecting to your own capacity to heal. So you've been bounced around the system. Here's this guy, David Hanscom, promising all this pain-free life. Well, that's not what's in your brain. Your brain is, you're angry. You've been bounced around. You've not been given a solution. Medicine has really done a bad thing to you. I'm sorry about that. I apologize for my colleagues. I apologize for myself. I was part of that whole deal. So if I hadn't gone through my own process, I would not have any insights. So I'm not trying to throw my colleagues under the bus. We just aren't trained correctly. It's a big problem. So you've been bounced around, you're discouraged, you're in the abyss. There's no reason you should believe anything I'm saying today. So connect with the disbelief and just start doing the work of reprogramming your brain. So again, it's not magic. Life is magic, by the way. Just being alive is a miracle. The body knows how to heal. So as you connect your own capacity to heal, which is not positive thinking, it's a positive vision, as you pointed out earlier, that's where the healing occurs. So again, the bottom part of the tree is connection, which means your own healing capacity, which is right there with doubt, skepticism, etc. The confidence to start processing that, and the creativity will emerge on its own. So
absolutely. I'm gonna wrap with a last question that I think I'll take the answer here. It's Liz asked, why does it take some people so long to heal? And I think I'm just going to go back to your tree metaphor. Plants grow at all different rates and paces.
Mm-hmm. Right.
And some trees are oak trees and they grow into big, huge, beautiful trees, but they take hundreds of years to get there. And, some plants are vines that drip quickly. There's no right way to be a plant, and there's no right timing on this recovery journey. The only thing that's right is taking a step forward, whether that's reading a book or working with a coach or a program, but take a step, because this pain is not a life curse. It's an introduction. It's an invitation to come on a journey.
Can I finish?
And with that,
can I finish with
yes.
the story?
Yes, I love finishing that way.
Okay, so I've had a lot of patients also go to pain-free within 2 to 4 weeks. And the first thing I say, look, I'm excited for your success, but you're going to go back in the hole because you're going to get triggered. So the skill is actually learning how to come out, right? That's the real skill. So you minimize time in fight or flight, maximize time in safety. So I have a girl I've been working with for at least 6 months, and just horrendous issues, extreme anxiety, obsessive thought patterns, horrendous pain. And I had given up. I just gave up. I go, I can't help her. See, what the doctoring does provides a foundation, but I actually can't do what you do, which is the extra coaching. I mean, I do a group coaching, which is sort of educational more than anything, and that. So I realized it just was beyond me that I wasn't going to help her. So she comes on the group session I had today, and for the last 2 weeks, she all of a sudden just exploded out at a level you cannot imagine. So she's smiling, she's excited, she's out of her crises.
Amazing.
And the tipping point for her, which is the tipping point for everybody, she says, I decided not to be a victim anymore. Every person that heals actually learns how to process anger. It's always a tipping point. And so I was shocked. But I didn't do that. She just used her own information, the database, talking to people, figuring things out, and she figured it out. I was totally shocked. And as you know, we see this happen all the time in different forms. So she has 6 months of she has 6 months of struggling. Some people 2 weeks, all of a sudden they're fine. So everybody heals very much at a different rate. I've had some people a couple of years. So the key word I keep using over and over again, it's not patience. We don't want you to be happy being in pain. The key word is persistence. Just one step at a time.
I love that. Persistence. And ultimately, that's what gets everybody to find their tipping point.
Yep.
I love it. David, this has been such a pleasure.
Yeah, likewise.
Every time we've talked, it's a pleasure, but really fun to get to do it in a kind of structured way. I think there's a lot of folks on the call tonight who have, are saying in the chat, they're taking a really important piece home, and we're really excited to continue to be able to share your wisdom. Yeah, I'm very appreciative for all you've done.
And I also encourage the audience to reach out to me. I mean, this is why I quit my practice to do this. So, if you have questions, please contact me. I'm pretty available. And so I try to get back within a day or two. So yeah, reach out with questions. It's a huge paradoxical shift to go from fixing to moving away from the pain. And so it takes lots of questions to get that get that switch flipped.
Agreed. Right. Well, thank you for starting to lead the way and being a resource for people too.